Okay, as the presenters were showing, today is the urinary and reproductive system. So, kind of like the overview of what we were going through today. We had this presentation, and we're gonna go through the urinary system and reproductive system terms. And if you have time, we'll try to review the case report 5. I think that one was the I forgot the name of the medication. Semu. Uh, yeah, secukinumab. And inflammatory bowel disease, that case reports. Okay, so so starting on with urinary system, um, site O is a combining form that means urinary bladder mostly. It can also mean sac of fluid, but I think it's usually more used as like a urinary bladder. Or if it's just used as like a single term, cyst, that usually means like a sac of fluid or some pus or something. But cyst O, like one example is cystitis, cysto plus suffix itis, cystitis, which is the inflammation of the urinary bladder. I think that diagram kind of shows like it's like a little redder than a little more red than the normal case. It's like a cystitis. It's like inflammation of the bladder specifically. But usually, if you have like an inflammation in the urinary bladder, it's most likely due to like infection, and usually it's already spread to like other areas as well. Um, nephro is a combining form. It means kidney. So nephritis, it's a one example for nephro. I know I have a lot of like examples that go itis, like some kind of inflammation for any kind of like combining forms, but it's just that like a lot of these terms kind of only have like very few use cases. The terms I try to like find are one of the more like used ones, but some of them only exist for like one specific disease they want to refer to. But nephro, I think like has like a lot of use. Nephritis is inflammation of the kidney. So I think this is the same kidney diagram the presenters were using. Kidney is the organs that filter the blood to get the waste into urine. And lith, suffix lith or combining form lith O is a combining form that means stone, or the stone is also called calculus sometime. Not like a math calculus, but as in like a calcium stone, calculus. So one example is lith. So cysto is a combining form for urinary bladder, and then plus lith, stone. So it's a calcium stone in the urinary bladder. And that's like a very extreme case, but usually you will have like a multiple small like hard like actual rock of like calcium stones in your urinary bladder. But if you leave it for too long, it can get as big as like a longer than a centimeter. Yeah, that would hurt a lot. Yeah, I heard like a kidney stone or like urinary bladder stone like it's one of the most painful like disease to have. Suffix lysis. So lysis usually means breakdown of something, but it can also mean separation. So one example is nephrolysis. So nephro, it was kidney from before, and lysis, separation in this case. So nephrolysis means surgical procedure to set kidney free from adhesions. So, for example, in this diagram, uh, the surgeon is using a tool to separate kidney that was stuck to peritoneum. And I don't know the reason for it, but apparently it was stuck. So it's detaching from the peritoneum, and that separation is called lysis, nephrolysis. Okay. So this was another term that was in the presentations. I mean, the presenter's words lists. So dia is a prefix that means through or across. More common use is like diarrhea, like your poop just like coming through. I guess you can like think of it as that way, dia. So dialysis is dia plus lysis, which was breakdown but more separation in this case. So dialysis is the process of removing waste from the blood across the membrane artificially. So usually kidney would do this job, but if your kidney fails or have some kind of like a urinary problem, then you would have like a dialysis machine attached to you. So like it takes the blood from you that has like a lot of waste, and there's like a porous membrane that filters out all the waste products to be thrown away, and like the clean blood will circle back to your body. That's like doing kind of like an external kidney. And people who do dialysis usually goes to like hospital like almost like once or twice, I mean, twice or three times like every week. It's like for like an hour, and yeah, it's almost like a lifetime thing, so it is very inconvenient for them. So I think there's like a lot of demand for like having more having like ways to do dialysis like at home in like cheaper cost, but hopefully that comes soon. uh yeah. Oh, it is also called hemodialysis. uh Sometimes basically the same thing. Hemo, which was blood, hemo. Yeah. And uh HAMO, that's also like the same thing as HEMO. It's just like the different way like they used to write during like the Latin Greek time. I think this was like in the guest lecture too. It's kind of interesting to hear the reason for it. Uro is a combining form for urine or urinary tract. So uremia is one example. Uro plus emia. If you remember, it's like a disease or condition involving blood condition. So uremia is toxic retention of urinary waste products in the blood. So when the kidney is not able to like properly filter out the waste, it's like uremia can happen. I think that diagram just like colored everything black, as in like kidney is not working. Also, always like let me know if I like am going too fast and like you want me to stop, so you can like keep taking notes. So urethral is combining form for urethra. Pretty straightforward. I think every term in this lecture is very like straightforward. So one example is urethritis. Urethro plus itis, inflammation of the urethra. So urethra was the duct or tube leading from the bladder to the external portion, so you can actually excrete out your waste product. And urethritis is like the inflammation of that urethra. So suffix urea, actually, it's more like uro, the combining form, plus suffix ia or disease or condition. I combined that urea, but I just like made it like a separate slide. Um, so suffix urea means urination or urine. One example is polyuria. So poly is like something you use for if you have multiple of something, polymer. Uh, yeah, polymer, for example. And so prefix poly means excessive, and combine the suffix uria, polyuria, it's like excessive urination. And calciuria is another example. Calci is a combining form that means calcium. It's another, oh yeah, it's combining form for calcium, and suffix uria. And you combine that, calciuria is if you have calcium present in the urine. So urine is basically like whatever is excreted through urine tells you a lot. Like if you have a lot of this thing called bilirubin in the urine, it's like bilirubin is basically digested. It's like a byproduct of digesting red blood cells. So if you have a lot of like bilirubin in your blood in your urine, that means a lot of your red blood cells are getting digested, which is probably not a good sign. Um, Also, that usually means like you have like a liver problem. And yeah, and when you do those like urine dipstick test, it's called urinalysis, kind of like dialysis, urinalysis. Well, this is different lysis, but kind of more like urine analysis. Vesico is a combining form for urinary bladder. So one example is vesico-vaginal fistula, kind of breaking down the term. First, fistula is when an abnormal connection is made between two body parts. Like for example, in here, bladder should be separate, vagina should be separate, but there is an abnormal connection between bladder and vagina, so your urine can actually leak through your vagina. That would be one case of fistula. There's also like anal fistula, when like a new channel is made next to your anus. So like your poop is drained to like another part. It's kind of weird, but fistula is when a connection is made between two body parts. Vesico-vaginal fistula. So vesico was urinary bladder, vaginal, which means vagina, and suffix al pertaining to. So vesico-vaginal fistula is an abnormal opening between bladder and vagina with continuous leakage. So yes, as I said, you would have some like urine leakage to vagina through fistula, and that can either cause um, damage to your vaginal wall because your urine is a little acidic, and it can also cause infection because there's like extra liquid in the vagina. Um, Hydro is combining form that means water, and one example is hydronephrosis. So hydro plus nephro, which was kidney, and osis, any kind of normal condition. Hydronephrosis is the swelling of one or both kidneys due to backup of urine caused by a blockage in urinary tract. So kind of like the name hydro suggests, if you have like a something like a stone, like a lith blocking here, and your urine cannot be delivered to your bladder, and like everything is kind of like stocked up here, and the urine starts swelling your kidney, that's when like hydronephrosis. It's different from inflammatory kind. So if it's swelling because of inflammation, it would be called nephritis, but this is because of just water filling up, I mean your urine filling up. Pyelo is combining form. That means renal pelvis. So renal pelvis, I think the presenters were going through. It's like this yellow area uh, that's connected to the nephrons at the very end to collect all the urine down to ureter and to bladder. So that's the renal pelvis, and pyelonephritis is one example. So pyelo, renal pelvis, plus nephro, kidney, itis. So pyelonephritis is inflammation of the renal pelvis and kidney because it's pyelo and nephro. Glomerulo, combining form, that means glomerulus. So glomerulonephritis. Oh, sorry. So glomerulus, to start with, is this bunched up region of arteries. So this is like the first place where your blood comes in to start getting filtered. So afferent arteriole is like where the blood comes in, and it looks like this, like such a tangled, like a ball of mess of arteries to increase the surface area, and basically this surrounding structure is called Bowman's capsule. It's basically like a muscle structure, and it will squeeze your uh, glomerulus, which is this ball of artery, to squeeze out the bloods and kind of like filter out everything first, including like your nutrients, vitamins, things that are like necessary to even. Everything's filtered out first. And then as we go on, like those will be either reabsorbed back, or more things that need to be secreted back will be uh, secreted back to the urine, like along the down the line. So that's glomerulus. And glomerulonephritis is glomerulo plus nephro, kidney, itis, inflammation. So glomerulonephritis is nephritis due to inflamed glomeruli causing protein and blood in urine. So yeah, so if the glomerulus is inflamed, mm, actually maybe yeah, I was wrong. Maybe it doesn't filter out everything at first. It's like, yeah, I'll check back on that. But glomerulonephritis is when the uh, glomerulus in the kidney is inflamed, and that causes uh, altered filtration in urine. Ureter O is a combining form. That means ureter. So ureter is the tube that connects from kidney to the bladder. So ureterolith is one example. Uretero plus the stone suffix that means stone, lith. So ureterolith is a stone located anywhere along the ureter. Stone can be located in that part of the ureter. Yeah, that looks pretty painful to have such a big stone and that narrow ureter. And if you have a stone there, it can block the urine from coming back down. And if you remember from previous slides, it can cause the buildup of urine inside your inside your kidney. It can cause hydronephritis, I think it was hydronephrosis. Hydronephrosis. Um, Suffix trypsy is means to crush, and this is almost only used for this one term, lithotripsy. So litho, stone calculus, plus suffix trypsy. So to crush stone. So basically, it's a procedure to crush urinary stones with a shock wave. So normally, you can just like hope for the best and let the your the force of like water push out the stones as you like urinate. But if the stones get too big, you have to go to hospital and get that treated. And how they remove those stones is they send like a very strong uh, shock waves, like a sound waves, into that area, specifically where the stone is. I think the patient is like usually uh, anesthetized during this process, and yeah, it shoots the shock waves, and that shock waves will break down the stones into like smaller pieces, and so that it can just like pass down through. Or if the shock wave is not enough, I think it also is the case that you can connect like a tube, insert like a tube into like straight to your ureter or like a bladder, and like let the stones come out like that. Suffix seal is a medical term for hernia, which we kind of like briefly mentioned last time. So hernia is like when some of your body part kind of like of bulges out and like invades the place that it's not supposed to be. So cystocele, cysto was urinary bladder plus seal, hernia. So cystocele is when muscles that hold up urinary bladder weakens or it stretches out too much, and that results in the urinary bladder to herniate, or they call it dropped bladder or sag of the bladder towards the vaginal wall. So this is how like a normal vagina and bladder should look like. But if your bladder uh, muscular wall gets weakened, it can like drop and invade the vaginal wall area. It doesn't like actually penetrate through, but it kind of compresses it. So this can cause some like problem with, for example, like menstruation, or um, just compression itself can also have bad effects on the uterus as well. So those were the urinary systems, and on to the reproductive system. Um, so uh, gynec O is a combining form that means woman or female. So gynecology is gyneco plus ology, study of something. So gynecology is study of female reproductive system. I kind of found that diagram funny. It's like, what is this? Cervic O is a combining form that means cervix, which is the neck of the uterus, like this area. I think you guys will pretty much know everything, but um, cervicitis is one example. Cervico plus itis, inflammation of the cervix. For example, like a bacterial infection happens and infects around this area, it can inflame the cervix. Colp O is a combining form that means vagina. So most used example is a colposcopy. It's when the doctors or surgeons like use this tool called speculum to widen your vagina to like see either if there's like a tumor inside, if there is no like inflammation on the cervix and stuff like that through the colposcope. So that's called colposcopy. Yeah, colposcopy is a visual examination of the cervix, vagina, and vulva. Vagina O is a combining form that means vagina. So both colpo and vaginal refers to vagina. Uh, one example is vaginismus, which is combining form vaginal plus suffix ismus, which is a suffix that means spasm or contraction, more like a spasm usually. So vaginismus is involuntary spasm of the pelvic floor muscles closing the vagina. So it's basically vaginal spasm. Um, yeah, and if you have like a either too much like shock to your vagina or something, it can trigger to very uh, tighten the opening of the vagina because of the spasm you see during like a sexual intercourse. Must O is a combining form that means breast. So mastalgia is one example. Must O plus suffix algia, which means general pain. So mastalgia is breast pain, basically. And suffix pexy is a suffix that means surgical fixation of something. So one example is mastopexy, so masto breast, and suffix pexy surgical fixation. So surgical fixation of breast, which is basically a breast lifting surgery. Um, yeah, and men O is a combining form that means menstruation or menses. So one example is amenorrhea. So A prefix that means something without, men O plus rhea, I guess in diarrhea, flow or discharge. So amenorrhea is absence of menstrual discharge or menstrual periods for 90 days or more. And this is kind of different from menopause. So it can be caused by menopause, but not all amenorrhea is menopause. So it's not the same thing, but it's type of menopause. I mean, I guess caused by menopause, can be caused by menopause. Hyster-O is combining form that means uterus. And one example is hysterectomy, um, which is a very common surgery done if you have like a cancer in your uterus or in your female reproductive system. So hystero plus suffix ectomy, surgical removal of something. So hysterectomy, surgical removal of the uterus. And depending on the needs, apparently I didn't know this, but you can do partial hysterectomy, saving like the bottom half portions with the cervix, or total hysterectomy, the whole uterus, or radical hysterectomy, even including like the fallopian tubes and ovary, which I assume in the case of like a very severe cancer, you would do like a radical hysterectomy. Um, Salping O is combining form that means fallopian tube. Fallopian tube was the tube that leads from ovary to the uterus. That's where the egg gets fertilized as well. So one example is a very weird word. It's called salpingo ophroectomy. So salpingo was fallopian tube, and ophro is a combining form that also means ovary. And ectomy, surgical removal. So salpingo-oophorectomy is a removal of fallopian tube and the ovary. So as in this case, like during salpingo-oophorectomy, the green portions in the diagram will be removed. Ovary O is a combining form that means ovary. So ovariectomy, when you remove only ovary, it's ovariectomy. Ovario plus ectomy, surgical removal. Surgical removal of an ovary. And as it was the case in previous slide, it can also be called oophorectomy. Yeah. Mm. And orchi is a prefix that means testicles. So I should have brought a different example, but one example is orchiectomy, where you remove the whole testicle. Um, so orchi plus ectomy, surgical removal. So surgical removal of one or both testicles. You make an incision into your scrotum and actually take out the testicle and cut the tube out, so you can remove the whole testicle like that. Test E is a combining form that means testicle or testis. So testis is one example. Um, testitis is one example. Testi plus itis, so it's an inflammation of one or both testicles. And as you could see, orchi is a prefix that also means testicle, so it's also known as the orchiitis. And yeah, basically an inflammation of the testicle. Suffix gravida is a suffix that means pregnant. So primigravida, primi is in like a first of something, primal. And gravida, primigravida is woman during her first pregnancy. So first pregnant. And suffix para is a suffix that means to give birth. So primipara, again, primi, like it's in like a first, plus suffix para. Primipara is when woman who has given birth only once so far. It's called primipara. So this is to distinguish, like for example, in like a in like a case report, you would say this is like first time this patient was giving a birth, because like when you give the first time, like hormone wise and like how your uterus is structured too is different from like the second or third birth. Um, yeah, I found like a nice diagram for stages of labor. You start with the contraction, push the baby out. Stage 2, pushing and birth. Head of the baby comes out first. I think you see during this stage, like if you are in like a hospital, like the doctor helps out, like pull the baby out. And stage 3 is the baby came out, and you can take out the umbilical cord and placenta as well from the womb. So yeah, those are all the terms I had for today. Yeah, it was pretty straightforward, and I don't know, like I would go through like that fast. So I think we're gonna end early today. But case report 5 was I think this is the first time I'm actually getting to the review of the case report because I was so tight on time. But it was the one that was on the inflammatory bowel disease, and they were treating the they have previously been treating this patient with secukinumab, which is a treatment for psoriasis. But then this case report shows that secukinumab can actually trigger inflammatory bowel disease, which is kind of interesting because psoriasis is an autoimmune disease, and you use like a drug to lower the immune activity, but then drug that lowers immune activity actually triggers inflammatory bowel disease is I found it very weird and interesting. So some background information. Uh, Inflammatory bowel disease is a group of diseases that refer to inflammation of the digestive tract. And two main types of IBD. Oh, it's in short, it's called IBD. So two main types are ulcerative colitis and Crohn's disease. So ulcerative colitis is so colitis was colon plus itis, inflammation of colon. So ulceration along the lining of the colon can cause inflammation. So ulceration, like open scars or like sore that forms in the epithelial layer of your colon, and that can trigger inflammation because your body is basically getting in contact with like an external fluid through that open scar. So ulcerative colitis happens with ulceration within the colon. And another case is called Crohn's disease. So this is when the lining of the digestive tract gets swollen. So Crohn's disease is this one. You can see the muscular lining is very swollen. We call it muscle hypertrophy. Remember, like hyper, excessive, and trophy. I forgot what trophy was. What was trophy? Hypertrophy. But basically, uh, very overgrowth of muscle. I think you can think of it that way. Hyper. Uh, and it can also have like a fissures, which is like a scarred like that goes into those like swollen muscle, so they can this can kind of like act similar to ulcer. This is where like the very sensitive like the cells can get exposed to like external like environments, like inflammatory stuff. Yeah, so Crohn's disease and ulcerative colitis, those are two main types of IBD. And secukinumab is a monoclonal antibody. So it's an antibody that is used to reduce IL-17A. So it's like IL-17A, it's a acronym for interleukin 17A. So it is basically a cytokine that causes inflammation on causes to trigger your immune activation to cause some inflammation. And what that monoclonal antibody does is it binds to that IL-17A, so it cannot bind to other things, or it will bind and like cause other like macrophages to like phagocytosis. Those IL-17A, so IL-17A cannot cause inflammation anymore. That's kind of how it works. But for it's used for treatment of psoriasis and psoriatic arthritis, as I was saying. But this paper was suggesting that secukinumab treatment for psoriasis might actually induce IBD as like a byproduct, an unintended product. So uh, I took out some excerpt from the case report section, and it kind of goes like biopsies were taken and pathology showed chronic active colitis with large ulcerated mucosa associated with inflammatory debris and prominent acutely and chronically inflamed granulation tissue with extensive plasma cell infiltrate. So I kind of highlighted the new terms we never covered as in purple, and bolded like the terms I kind of want to go through briefly. So pathology is patho plus ology, which was the study of diseases and their causes mechanisms. Colitis, colon plus itis, inflammation, so inflammation of the colon. Granulation tissue, so granulo is a combining form for granules. Oh, by the way, if you are concerned about like the exam or like what I am gonna ask for like during like the project and everything, I'm only gonna ask for like anything in like blue or orange. So this one, I will never like ask about it. Granulo, granules plus ation, suffix that means process, granulation, granule formation. Tissue, so a temporary, highly vascularized connective tissue that forms during wound healing process. So for example, during that ulcerative colitis, while that wound is healing, it can form granulation tissue within the epithelium. Uh, Infiltrates is a term that means when material or cells that have passed into tissue where they are not normally found. So infiltration isn't like invasion. In this case, extensive plasma cell infiltrates. Plasma cells are the basically a type of B cells that are very focused on producing antibodies. So basically like an antibody producing like factory. And those plasma cells are not supposed to be there, but it infiltrated into the area. Another excerpt is secukinumab therapy was discontinued, and the patient was initiated on intravenous methylprednisolone. 2 weeks after steroid therapy initiation, repeat sigmoidoscopy demonstrated reparative changes of the colonic epithelium. So intravenous, IV, you might remember from the skin, the integumentary system lecture. It's intra plus veno, vein plus us pertaining to. So it's injection into the vein, which would be this one, into the blue vein. Sigmoidoscopy, sigmoido as in sigmoid colon. I was curious what the root for sigmoid is and searched up. Basically, the sigmoid came from, uh, it basically means the shape of Greek letter sigma. So sigma, the one you're probably familiar with is like the one that looks like E, but I think it's referring to this one, like a S shape. So, and sigmoidal colon is basically like S shaped if you actually look at the diagram. So, yeah, that's where the sigmoid O comes from. Sigmoidal colon, scopy, visual examination. So, visual examination of the sigmoid colon. Epithelium is a thin protective layer of cells that divides internal organs from external environments. And methylprednisolone, I think that was one of the medication that was mentioned there. It's a corticosteroid. It's a steroid hormone. I mean, steroid drug. Usually, any kind of steroid drugs acts by reducing inflammation. Kind of, you can think of it as like a fight or flight response. When you're in the fight modes, you will release steroid in your body, and when you're in the fight modes, you want to like do like physical activity, and you're ready for like any like responding to new stimuli. Only when you're not on the fight or flight mode, like kind of like resting, can your immune system like come back on and start acting. So steroids basically stimulates that fight or flight response, so to turn down the immune system. And yeah, I think it's also called prednisolone. Variant is called like prednison as well. And this is optional. You're free to head out. I think it ended up pretty early. Yeah. Hopefully, if you guys have midterm, feel free to study for those. Um, but if you want to stay a little longer, uh, it would be nice to have like a group discussion on share one interesting thing you learned from this paper besides terminologies, like what was interesting about the disease, what new concept or idea was suggested in the discussion or conclusion section that was interesting to you. Yeah. So feel free to discuss, but you're free to head out. And oh, I'll share the announcements as well. But case report 6 due next Monday. Next week is the nervous system and visual auditory system. So groups who are presenting them will be presenting those for heads up. And don't forget to fill out attendance before you head out.